Right, vaginal rejuvenation. If you or your partner are having trouble feeling the sensation of each other, you'll want to pay close attention. For some women, and we do want to emphasize some, sexual intercourse serves no pleasure. That's because their vaginal muscles have become so loose they can't feel friction during intercourse. That's where Dr. Matlock steps up to the plate. Take a look. 12 months ago, 31-year-old Regina Black went after a different kind of thrill, and it wasn't cheap.
Like skydiving. I don't want it to end.
A thrill that would take her above and beyond a form of pleasure that until recently was a distant memory.
I was unable to feel him, okay? And he even made comments on how so-called loose, quote, I was.
Regina represents a growing number of childbearing women wanting to tighten their vagina to increase their own sexual pleasure. How important is a tight vagina to you?
It's very important.
Why?
I mean, I want to be able to enjoy sex also. I want to be able to feel him.
To get that feeling, the mother of two teenagers turned to a very unusual source.
This is the retractor that we use.
On average, 20 women a month make their way into this Beverly Hills operating room where they spend anywhere from $5,000 to $8,000. Most of them do it for one reason.
I wanted to satisfy myself and as well satisfy him too.
We're preparing the tissues for our laser procedure.
For Regina Black, this 1-hour laser surgery was a godsend which changed her position dramatically. And within weeks, she was back on top.
But when I say we're really into sex, we're really into it.
She attributes the success to laser vaginal rejuvenation surgery. This is where small laser incisions are made at the top and the bottom of the vaginal canal. The vaginal muscles are then brought back together and then stitched into place to have the excess tissue removed. The end result? A supposed tighter vagina, leading to heightened sexual pleasure.
We will ask the patient, how tight do you want to be? And we can accomplish this.
Dr. Dr. Matlock pioneered the procedure after treating a patient for stress incontinence. In other words, an uncontrollable bladder.
What we did is took the procedure, modified it.
By doing so, the licensed gynecologist is creating a niche that continues to be ignored by traditional gynecologists.
There's over 25 medications out there for male impotence and virulence. It takes $500 to $600 million to bring those medications through research and development to market. Is there anything remotely similar there for women? No.
Through his own initiative, research and marketing, Dr. Matlock has built a very successful practice.
We have treated patients from over 34 states and 19 foreign countries, so something's working.
On a scale of 1 to 10, what was your sex life like before the surgery?
About a 4.
What was it after?
A 9.
For Regina, that 9 is just fine, despite what others may think.
Well, my mom said to me, well, Regina, well, you think he was a little small? That's why you weren't able to feel him?
Well, prior to the surgery, Regina did try Kegels. That's an exercise where women discreetly contract their vaginal muscles. As for Dr. Matlock, he doesn't accept just any patient. He says there's an extensive screening process because he wants to make sure patients are having the surgery because they want it and not because they're being pressured by, say, a boyfriend or husband.